Welcome back, dear viewers, and right now in the studio we've got Dr. Issa Almashmoom, pediatric neurology, epilepsy, EEG, and brain stimulation. Welcome to the studio.
Hi, welcome, Dahej. Nice to meet you, and I have the pleasure to be in KTV too.
Well, the pleasure is ours, of course, to have you here with us in the studio, of course, and in Hala Kuwait. Well, today's topic is very interesting, especially for the parents.
Yes.
So basically, we really would like to know what are the main benefits of brain stimulation for children.
Yes, first I would talk about specialty. First, pediatric neurology is a rare specialty. We don't have a lot of doctors around the world, not only in Kuwait. And also, I'm the first Kuwaiti have a certified pediatric neurology board.
MashaAllah.
Yes, I postgraduate from King Faisal Hospital in Riyadh, in KSA, Kingdom, Saudi Arabia. And also, I specialize in epilepsy and EEG. Also, I done my brain stimulation specialty in Munich, Germany.
That's right. Really nice.
It's a new field. It is related to the biomedical engineering and the new medicines that help us to find new solutions for a lot of diseases, neurological diseases, especially in the neurorehabilitation and also for mental health, psychiatric disorders. And it also it contains a lot of devices and information that maybe we need a lot of episodes to talk about it. So I will try my best today to minimize it as much as I can.
Well, I would like to have you in our upcoming episodes as well. We'll be happy to have you with us to explain more and tell us more about it.
Yes.
And we gotta do our best to protect you, right? Because you're one of a kind, rare.
Yes.
So you mentioned something about the brain stimulation and the EEG and all these kind of things. So can we know what is an EEG test actually, and how does it help diagnose the epilepsy?
Yes, EEG is the golden tools for any neurologist. If you need, it is the tool number one in diagnosis of epilepsy. So it is a shortcut of electroencephalogram. So it is help us to know about the brain waves, and we look if this patient his brain wave are normal or not, or he had epileptic discharges that help us to diagnose the epilepsy. Also now there is a new method for EEG. It's called QEG.
QEG.
It's quantitative EEG. This type of test not only showing the brain waves, also it will show us brain mapping, how the brain is functioning, relating to the different loops of the brain.
So that's more advanced.
Yes, more advanced. Also, I'm only one in Kuwait specialized in this QEG.
That's really nice.
Yes.
All right, doctor. So as far as I know, the EEG began in the early 2000s, and now you mentioned we've got the EQ, so more advanced. So what is actually an EEG test, and how does it help diagnose the epilepsy?
Yes, I will correct a little bit. The EEG's first time, the guy who recorded an electrical activity from the brain, it's Tom Berks. It done in late 60s, early 70s.
Oh, wow, okay.
So, and for the QEG, it appeared in the last 20 years. And it is more advanced than the EEG that, as I told you, it will show us brain mapping, how the brain is functioning. And all it depends on the brain waves. We have 5 major or 6 major waves. Every brain wave has specific function. We have the delta, theta, alpha, beta, gamma. All these brain waves, each one have a certain frequency, and each one, it will have a certain function in the brain.
MashaAllah, this is really nice. So basically, we get to see every single detail in the brain, from the beta, alpha, and the gamma, and all these kind of things with the new advanced technology.
Yes. And this, the EEG, it will help us, as I told you, in diagnosis of the epilepsy. If any patient had abnormal movement, convulsions, seizures, or we are doubt about any abnormal behavior. So we will do first tool for us to do an EEG for him to see if he had any abnormality in the brain waves. Okay, if we found that this abnormality, so we can diagnose him what's happening with him, and we can prescribe the correct medication for him.
All right, fair enough.
For QEG, no. It will give us more information. It's not only the epilepsy and the epileptic discharge, it also gives us about the attention of the patient, the memory, working memory, the emotion, the language. It will give us also about the sleep patterns, of if he had any problem in the sleep or not. Okay, it will give us a lot of information.
Oh, that's a lot of details
yes.
Coming from the machine. This is really nice.
Yeah.
So, what do actually parents usually get wrong about the EEG tests? Like sometimes they're like have misconceptions about it.
Not all the abnormal EEG need a treatment. Or not all the normal EEG that mean that their child doesn't have any problem. Because we have some of type of the epilepsy, we call it frontal lobe epilepsy. Usually, if you do the EEG, it's almost normal in the awake and sleep time. So the parent, they said, okay, if the EEG is normal, why you want to start a medicine for my child? Usually, no. For these cases, we need to start a medicine to prevent this attacks to happen. Especially, it's happen more in that sleep time. That we call it nocturnal seizures.
So this happens during sleep.
Yes.
All right. Yeah. So, doctor, how, can you tell us how pediatric neurology changed recently in Kuwait?
Pediatric neurology now it's going up specialty. Now we are increasing in number of the doctors who specialize in this field. I'm happy that we have now new colleagues that are joining us.
Yeah, in the same field, since you mentioned it's rare. Yes, definitely.
Also, in the pediatric neurology, we have different subspecialties in the pediatric neurology. For me, it is an epilepsy and EEG. Some people they are specialized in movement disorder, and some people they are specialized in stroke. Some people are specialized in the autoimmune disease. So now this type of field it's going up, not in different world. Many people now they are looking for this field, and they are interested in this field, and they are studying the subspecialty of this field.
That's very interesting. Best of luck for all the co-workers and colleagues in the field. So, doctor, when is brain stimulation better than using medicine? Like sometimes people prefer, medicine. Sometimes no, they prefer the.
Most of the people they don't like medicine, and we know most of the medicine they will have the side effect.
Definitely.
If you have a solution that you can treat a disease or a problem without any side effects, so I will go to this solution. Why not? Okay, especially we have different devices that help us to help many children, especially the one with the ADHD, ADD, autism, or autistic spectrum disorder, learning difficulties. All these children, usually in the 15 years back, we used the medicine for brain stimulant to help them to get benefit in their school performance.
Now, so it's like a boost to the performance.
Boost, yeah. When he takes this medicine, he's doing fine, but when he stops the medicine, he returns back to his problem. But also, some of the patients, they will have side effects from using this medicine for long times. Now with the QEEG and the neurofeedback, we can solve a lot of these problems without side effects, zero side effect. And also we can train the brain, after 60 sessions, that he doesn't need any more an intervention.
That's really good news.
Yes.
And thankfully we've got the machines, we've got the technology right now, and all the advancement, and of course we got doctors, as you mentioned, so this is really nice.
Yes. And it's not only using for the patient with the learning difficulty or attention deficits or hyperactivity, it's also used for people with the sleep difficulties, people with chronic pain, fibromyalgia without any cause. Sometimes they will go for different hospital, different clinic, different doctors, and they prescribe a lot of analgesic without any benefit, and they done a lot of tests without any cause. So these people usually will get benefit from this brain stimulation to get rid of this chronic pain. Also for the anxiety, PTSD, OCD, obsessive compulsive disorder, depression, all can help these people to treat without any medication.
That's really such insightful information, Dr. Issa. So we've got more questions coming next, but for now, let's take this quick break to check this report, and then we'll be back. Welcome back, dear viewers, to the studio of Hala Kuwait. Of course, we've got with us still here Dr. Issa Almashmoom, pediatric neurology, epilepsy, EEG, and of course, brain stimulation. So, such a interesting topic right now we've got here. Also, again, for the parents that have to be aware regarding, you know, their children and the matter of the brain and stimulation and all these kind of things. So, basically, now let's head to the question, which is, why is it hard to diagnose epilepsy in infants, since we're focusing on you know, kids and small?
You know, the children or infants, it's not like adults. Usually they cannot explain what happened to them. So I advise the family of the child that if you can get a video for the event that their child gets, it will help me a lot in the diagnosis. Because sometimes the family, they cannot describe what's happening exactly. Also the child or the infant, he cannot say what happened to him.
Yeah, probably the family will exaggerate because they're you know, scared for their kid, and of course the infant is.
Some of the abnormal movement, it's a normal variant. No need for medicine. It happens like a
something like common
habits. Yeah. So they get along with the diagnosis of epilepsy for these habits or normal variants. So we should see what's happening exactly. It will help us in the diagnosis.
All right, fair enough. So does actually brain stimulation affect a child's learning or growth, if you will?
Yes, we can help him in increase his school performance. We can help him in getting a good memory for studying. Also, we can help him to organize his pattern of sleep, because sleep is very important for us to have a good memory and good focus in
also
the next
to
day.
Grow, as far as I know, it's very important to have a good time of sleep.
Also, you know, this technology of the neurofeedback, and it's not used only for these children. Or some people, adult people, like football players or instruments, or musicians, they are using this technology to increase their big performance.
Well, that's really interesting.
Yes.
So the artists, players all over the world, and
yes, most of the players, Ronaldo, Messi, all these players, Muhammad Salah, they are doing this technology for themselves, so he become more efficient, or his big performance in the game, it will be going up.
It will give them a boost so that they do better at whatever they are doing. This is really interesting.
Yes.
So, Doctor, can you elaborate and tell us how has new technology made EEG tests more accurate?
Now, for the new machine of the EEG, it have some intelligence computer that detects the abnormality.
So now we've got AI in it.
Yes, AI, and it can help you. If you pick up any abnormality in the EEG, they will give you an alarm. See, you must check this one, it is abnormal or not. But the accuracy, it's good. For some machines, some of them, you need an expert to explain this abnormality.
Definitely, but with time, I mean, it's getting better and better with the technology that we've got.
Now, most of the family, when they saw something with their child or infant, they will search it in the chat,
yes,
GPT.
And
they get, most of them, they get the right diagnosis. So, but they will come to me to double check this is the right diagnosis or not.
I mean, yeah, everybody uses AI tools right now, but hearing the word from a doctor feels better, to be honest, because, I mean, you have to see someone face to face.
It helps us to consume the time before we spend a lot of time to explain for the family, I need to do this. Now he already read everything. He said, I want to do this test.
So they know the procedures, they know the tests, and probably the side effects. So they have done their homework before coming to you, which makes it easier for you guys, right?
Yes, now it makes much easier for us. Also more challenging for us to get an accurate diagnosis like the AI.
Fair enough.
Yes.
All right, so Doctor, what are the most promising new treatments for pediatric epilepsy?
Yeah, the treatment for pediatric epilepsy now, we had advanced treatment regarding the medicine-wise. Now we have a new generation of anti-epileptic with less side effects, more efficient than the old generation. Also, we can do the brain stimulation in treating the epilepsy without medication.
All right, that's nice.
Yes, usually I was giving the children for the benign epilepsy that they usually outgrow it when he go up, or before puberty, maybe he get trapped without any things. Usually we give the medicine for 2 years. Now with the using of the brain stimulation, I can give the medicine only for 1 year, and he will become okay.
That's really good.
Not only I give him the medicine for 1 year and he get trapped, also I can help him to increase his big performance in the school.
Interesting.
So we have benefit from this brain stimulation, and now in treating the epilepsy.
Yeah, and like getting rid of the medicine as soon as possible is much better to avoid the side effects.
Side effects. If you use the medicine for a longer time, you will get more side effects. If you use it for less time, it's much better.
And now we've got the full effect, no need for medicine, just the advancement of the technology.
Yes, usually I will give medicine in the beginning to stabilize the patient. I make sure that he had no more convulsion. Then I will start for him in the next follow-up after maybe 1 year. I will do the QEEG for him. Then I will start with the neurofeedback stimulation.
All right, fair enough. All right, so what is your top advice for families living with epilepsy?
Epilepsy, it's the disease. Most of the famous people, they have epilepsy. Napoleon Bonaparte, Van Gogh, Leonardo da Vinci. But they become great people, and they've done great things for the world. So epilepsy, it will not prevent you to become a famous or to become a doctor of epilepsy. I think it's social stigmata. Most of the family, they don't want anybody know their child that. But I told him, don't worry, he can live his life easily, normally, and he can only take his medicine and he can do whatever he wants. Yeah. Don't worry about the epilepsy, that it will affect his life. I have many patients with epilepsy. Now they become doctors, they are teacher and faculties, and they are, some people, they have big positions also.
So basically nothing can stop you from being whatever you want to be.
Yes.
And it can be treated, and normally you can live like any other person in the world. Well, thank you so much, Dr. Issa, for elaborating and giving us these insightful information regarding this topic. Of course, we would like to have you in another episodes to give us more stories and examples about the advancement of the technology regarding this matter. Well, you heard our doctor, dear viewers, and with that said, we have reached the end of this interview. Thank you for tuning in, and of course, stay tuned because we've got a report, and then we'll be back soon.